Many people have contributed to public health throughout the years. Today, we're going to highlight three influential Black women who contributed to the health in America. Dr. Iona R. Whipper was a physician and social reformer. She was born in 1872 in South Carolina, but her family moved to Washington, D.C. when she was a child to escape racial violence. After teaching public school for 10 years, Whipper decided to go to Howard Medical School, where she graduated with an emphasis on obstetrics. After her residency, she established a private practice in Washington, D.C. A few years later, she started her public health career as an assistant medical officer for the Children's Bureau of U.S. Department of Labor. She toured the South and instructed midwives in childbirth procedures. After returning to D.C., she started to mentor girls in need. She assisted young unmarried women through their pregnancies and with infant care after their pregnancies. This grew as she enlisted help from other female doctors so she could reach more people. Eventually, she founded the Iona R. Whipper Home for Unwed Mothers, which was open to everyone regardless of race or religion. It was the only home that served Black women for over 40 years and is currently still a home for at-risk girls between 12 and 21. Mary Beatrice Davidson Kenner was born in North Carolina to a family of inventors. Her father, grandfather, and sister had several patents throughout their lifetime. Mary never received any college degree or professional training, but despite this, she invented a revolutionary device that would change the lives of women for generations. She invented the sanitary belt, the precursor to menstrual pads that we still use today. When she first brought it to a company to see if they were interested in manufacturing it, they ignored her because she was a Black woman. But in 1957, she was finally able to patent the device herself. Throughout her life, she worked for the government and owned a flower shop. All the while, she continued to invent things and had a total of 5 patents. 30 years after the invention of the sanitary belt, the patent expired. And a few years after that, a company took up the invention and started to mass produce Mary's sanitary pads. She never saw any of the money from their production, but because of her amazing creation, women everywhere have more freedom during their periods. Dr. Marilyn Hughes Gaston is the first African American woman to direct a public health service bureau and the second African American woman to achieve the position of Assistant Surgeon General and the rank of Rear Admiral in the U.S. Public Health Service. Gaston was born in 1939 in Ohio. Through her life, she was greatly influenced by strong women who encouraged her to dream big and work hard. After medical school, she started researching sickle cell anemia, which is an inherited blood disorder that results in chronic anemia and recurrent episodes of pain. Over time, it can cause weakness and even death. In 1972, she became the director of the Sickle Cell Disease Center in Cincinnati. A few years later, she left to work for the National Institute of Health as an expert on the disease, eventually becoming deputy branch chief of the Sickle Cell Disease Branch. She worked with the NIH for 14 years. She once said, "If you change just one woman's behavior, you have a ripple effect. She's going to change her whole family." And these women all had a great effect on the healthcare of America that is often overlooked because of their gender and the color of their skin. But we can still celebrate their accomplishments and what they have done for all of us today.